guys, my name is Jenny from Live Natural, one of the nurses here, and today I'm going to show you how to reconstitute and inject peptides. You're going to be receiving a box full of a few items. Included in there is going to be your peptide, a syringe, a needle, and a few smaller syringes that you're going to use to inject. You'll also have some alcohol pads included. First thing you're going to do is you're going to open up your syringe, and you're going to take the bacteriostatic water that you're going to be sent with, pop the lid off, and take the needle that you're sent with, this pink needle, screw it on, take this bacteriostatic water, flip it upside down, uncap the needle, and poke the top of the bacteriostatic water. You're going to be drawing back on the plunger, and you're going to draw up 2 mLs. So go just past that 2 ml mark and pull out. Okay, then you're going to take your peptide, take the cap off, and you're going to be putting this 2 mLs of bacteriostatic water, and you're going to go right into the top of the peptide. It's going to pull the water right into it. Take the needle out, be careful with this needle, cap it, and shake up your peptide. Okay, so now this is ready to be injected. Depending on your dose, you're going to be either 15, 20, 30, maybe 50 units of your peptide, and this will be stored in the refrigerator. Make sure when you're done with it, put it in the fridge. After it's reconstituted, it needs to be in the refrigerator. Put it in a nice, clean, safe spot in your fridge. All right, so you're getting ready to do your injection. You're going to take an alcohol swab, and you're going to clean the top of the peptide. Make sure it's nice and clean. It's been sitting in your fridge. Okay. Now you're going to take a needle, or take a syringe. You're going to take this one off, that exposes the plunger. You're going to take this one off, that exposes the needle. Take your peptide, flip it upside down again, poke the middle of it, and now you can draw back to the desired amount of units. Whatever is on your treatment plan. For example, I'm going to pull up 30 units. Once you have your desired amount of units, take this out, and you're going to use this to inject yourself. So you're going to take an alcohol swab, open it, and you're going to clean the area of injection. Perfect. In a circular motion, that's awesome. Make sure you have clean hands to start. All right, now you're going to take the syringe and take off the cap. All right, now you're going to squeeze the area that you're going to inject. Perfect. Go in at a straight angle. Yep, perfect. And now inject. There we go, all done.